Bahareh Bahadini. I'm a medical oncologist from City of Hope. I work in Thousand Oaks and Simi Valley satellite offices of City of Hope. A little background about me: I did my training in and fellowship in medical oncology at City of Hope. Duarte, our main hospital resides in Duarte, but we have many satellite offices throughout town. And I work in the Thousand Oaks and the Simi Valley office. I was asked to participate in the community outreach, and as you may know, part of our mission at City of Hope is to provide outstanding care for our patients with cancer. And I'm sure there are many questions and concerns that you may all have that may pertain to your diagnosis of cancer or diagnosis of a friend with cancer or family member and or treatments that facing this pandemic. I'm hoping that this talk will provide a lot of solutions, or perhaps lesser the anxiety for those concerns of yours. About COVID-19, I think this is the most important question and probably the most important slide of this talk. What is actually coronavirus, and what is the difference between coronavirus and COVID-19? So I'm actually going to close up some of these here because so I can see my slides. That's perfect. I have them down here. So coronaviruses are a large family of viruses that are common in people and many different species of animals. And we're facing a pandemic today which pertains to a respiratory disease that's caused by a new coronavirus that's highly contagious, spreads from person to person, and it's referred to really as SARS-CoV-2. And the disease that it causes, it's named coronavirus disease 2019 or COVID-19. So the COVID-19 is really the term that's referred to the disease caused by this new coronavirus that's called SARS-CoV-2, or sometimes it's referred to as novel coronavirus. This is the poster picture of the coronavirus, and the reason I'm bringing this to our attention is because I wanted to let you know that the name coronavirus is actually derived from the fact that there are these speculations or spikes on the surface of the virus, making it look like a crown, and therefore the name corona, which is actually Greek for crown. This slide shows you the statistics that we're facing as of September 6 in the United States, the total number of cases as reported by CDC, the Center for Disease Control, by state and territory. About 6,227,000 cases have been recognized in the United States. Of those, about 188,000 have actually lost their life to this coronavirus pandemic. So that's about 3% of those population that were actually diagnosed with COVID-19. And as of September 6th, the last 7 days prior to that, 292,000 people were infected by this virus. Are you guys all able to see my slides? Okay, good. So what are some of the common questions I put in the next few slides? What are some of the tests that are available for COVID-19? There are basically two different types of tests for diagnosing COVID-19, which are FDA approved. One are referred to as diagnostic tests, and the other one is antibody tests. So let's go through them. The diagnostic test can tell you if you currently have an infection. The FDA has approved many of these diagnostic tests for COVID-19, including something that's called molecular tests. So molecular tests work by looking for the virus genetic material in a sample from you, either saliva or from the nose, nostrils, or from blood. The samples will then be analyzed in the lab, and these FDA authorized molecular tests are currently considered to be very accurate. And the results can be back anywhere from minutes to several days, depending on the test that they do. Diagnostic tests also include something that we call antigen tests, which is another type of diagnostic test to see if there are viral proteins in the sample taken from inside of the nose with a swab. These tests are often simpler, and they provide results much quicker than the molecular ways, and sometimes even within minutes. I personally had this test done prior to a procedure, and they called me back within 15 minutes and they gave me the results. So although antigen tests can be less accurate and they may need confirmation with an additional diagnostic test if there's still a suspicion for somebody to have a COVID infection and their test turned out to be negative, then we do need additional confirmation with additional diagnostic testing. But they can be made more widely available since they're very easy and simple. Antibody tests is another category of tests that is used to recognize whether somebody has been infected by COVID-19 in the past. So it's also referred to as the serology test. So let me put a little bit of an explanation here about this antibody test. So antibodies are produced by the body when you're infected by a virus, and they help your immune system fight off the infection. So an antibody test detects these antibodies to the virus using a blood sample. So if the antibody test finds these antibodies being present in the blood, it likely means that the person has been previously infected by the virus. So it's important to know that the antibody test doesn't really show if you have a current infection, and it shouldn't be used to diagnose a current infection from COVID-19. Can these antibodies provide protection from future infections? So if somebody has had COVID-19, are they protected from it? Does it mean that they won't get it again? Or who may be still at risk? Or who may be eligible to donate a part of their blood called convalescent plasma, which may serve as a possible treatment for those who are seriously ill from this COVID-19? So these are all some of the unanswered questions which we don't know. Currently, we think based on the information that we do have from the previous coronavirus family that was first recognized as SARS in 2003, that the protection may last anywhere from 3 to 6 months, but they don't really provide you much immunity beyond that. But this is a new coronavirus, and so even Dr. Fauci states that he doesn't really know what kind of immunity people will get. But the observation has been that the person who's had coronavirus infection, within 3 months, they probably don't get it again. But after 3 months, they may be, if they are exposed to it again, they may actually get infected. If you have any questions regarding this, immunity, if you've had a positive test before, you could refer to www.fda.gov/coronavirus for your questions. So how has the COVID-19 impacted the cancer community? It has had a serious impact on cancer diagnosis, treatment, and research. So many people, for example, have not been getting their screening tests when they needed to because they were afraid of catching the virus at the medical facilities. But the truth is the cancer is much more life-threatening than COVID-19. So for breast cancer, for example, the early detection with mammography and diagnosis can mean a high cure rate, whereas if the screening is not done and the diagnosis is made with a later stage in the disease, then the cure rate can drop dramatically. We know that the major weapon we have for against cancer is prevention and education to make sure that patients would go for their screening tests when they need to. So at the onset of the COVID-19 pandemic, elective medical procedures such as mammography or colonoscopies, including cancer screening tests, were largely put on hold to prioritize the urgent needs and reduce the risk of the spread of the COVID-19 in healthcare settings. And one consequence of that was that there was a substantial decline in the cancer screening. As the states and other authorities reopen the businesses and they go easier on the restrictions, many healthcare facilities are now starting to offer elective procedures again. And I know around my neighborhood, the radiology departments have started opening up their mammography, and hospitals have been offering more colonoscopy procedures for screening. Some cancer patients have really not, this is one of the other reasons that COVID-19 has impacted the cancer treatment, because some of the cancer patients have not sought treatment, or they have stopped their treatment because they were afraid to go to the hospital or clinic amid COVID-19. COVID-19 has also affected cancer research because many patients do not want to participate in the trials out of the fear of going to the hospital. Therefore, clinical trials, which are the most important part of clinical research, have really been disrupted. But taking the precautions, especially in tertiary centers such as our own organization, taking multiple precautions, most hospitals try to be COVID-19 negative as much as possible. And people should really not fear the COVID-19 while they're receiving cancer treatments, knowing that U.S. hospitals and cancer centers can provide top quality care while keeping their patients safe. So restarting cancer screening requires a careful consideration of the risks and benefits of screening, along with ensuring the safety for both patient and the healthcare personnel. So a lot of organizations are also considering cutting down on the number of patients that enter their organization to minimize the risk for their healthcare personnel. So it's not always the patients canceling their screening, it's sometimes they get canceled out by the radiology departments, for example. So if you had an appointment for screening mammography that was postponed or canceled, please talk to your healthcare team about that and to find out when you can reschedule. Your provider can discuss balancing these risks and benefits of being screened now versus postponing it to a later time, taking into account your personal history, family history, other factors, your health, how much at risk you are, your age, etc., and the timing of your last screening test. So if somebody has had their screening 2 years ago and they're already late, then you really don't want to delay that for another year. So decisions about restarting screening depend on many factors, and they may not be the same for every person. They will likely vary by community as well while the pandemic continues. So it's also important to keep in mind that we're focusing here on cancer screening. Screening tests look for cancer in patients that are really healthy otherwise, and they don't have any symptoms. But these tests are different from the tests that your doctor or your cancer doctor might order if you have symptoms that could be related to the cancer. So if you have signs or symptoms that might be from the cancer, for instance, a lump in the breast or blood in the stool, then you should discuss this with your provider right away, as you may need exams and tests that evaluates those symptoms for you. So the global pandemic of this coronavirus or COVID-19 continues to have a very serious impact on many people, including cancer patients, their families, and caregivers. So let's look at some of the risks for COVID-19. So are all people at equal risk for COVID-19 infection? The answer is yes. Anyone at any age can actually, who gets exposed to COVID-19 can get the infection. However, there are certain population and certain factors that increases the risk of developing a more serious infection from catching the virus. So those high-risk patients include anyone who's older than age 65, patients with medical problems like diabetes, lung disease, or asthma, and also immunocompromised patients, such as patients with cancer. So patients with cancer generally have a weakened immune system, and the weakened immune system, which is referred to as immunocompromising, are at increased risk of having a COVID-19 infection because their defenses against the infection are really lowered. So this includes patients with certain types of blood cancers, such as leukemia, lymphoma, multiple myeloma, that can directly affect the cells of the immune system, or patients who have undergone bone marrow transplant, or patients with other hematologic cancers, such as leukemia or a lazy bone marrow, which is referred to as myelodysplastic syndrome. Here's some questions that I thought might be helpful answering a lot of your concerns. So if somebody has cancer, are they at higher risk of getting COVID-19 automatically? So because SARS-CoV-2, this coronavirus, this new coronavirus is a new virus, anyone who's exposed to it is at risk of becoming infected and developing the COVID-19 disease. But like I said, certain hematologic cancers, such as leukemia, lymphoma, and multiple myeloma, they can specifically suppress the immune system and increase the risk of infection for that individual. Some cancer treatments like chemotherapy can weaken the immune system, and they cause you to be immunocompromised, and therefore can increase your risk of infection and illness. These are some of the other risk factors that can increase risk of severe illness from COVID-19, including asthma, heart disease, lung disease, obesity, diabetes. I know these are some of the illnesses that may actually increase other risks for other types of diseases such as heart attack or respiratory disorders, etc. But generally, immunodeficiency situations such as HIV and AIDS can also increase the risk. History of smoking, history of bone marrow or organ transplantation, and also prolonged use of steroids, which is a factor that reduces the immune system, can also increase the risk of severe illnesses. So the answer is yes, cancer patients might be at increased risk of serious illnesses from an infection because their immune system is weakened by the cancer itself or by the therapy. Okay, here's the next question. So if somebody is a cancer survivor, are they at higher risk for severe illness from COVID-19? Generally, people who were treated for cancer in the past may have a weakened immune system, which can increase their risk for severe illness from COVID-19. So cancer survivors may want to discuss their concerns about COVID-19 with their doctors. But most people who were treated for cancer in the past, especially if it was years ago, are likely to have normal immune function now, but each person can be different. So it's important that all cancer patients and survivors, whether they're currently on treatment or not, talk with their doctor who understand their situation and medical history to have a better understanding of what their risks are individually. So if you have cancer now or had it in the past, how could you protect yourself? Okay, so it's also important that to know that both patients and their caregivers should be taking precautions to lower their risk of getting COVID-19. U.S. Centers for Disease Control and Prevention has specific recommendations for people that are at higher risk for serious illness from this COVID-19 infection, which we're going to go through in just a few minutes. And while the situation continues to change, knowing some basic facts about what you can do to help protect yourself and others from getting sick can be very, very helpful and empowering. Okay, so how can we protect ourselves? So there's currently no vaccines to prevent COVID-19. They're working on it, but it's going to be a while before we can actually have a vaccine. Is there a specific treatment? Not currently. At this time, we don't have a vaccine and we don't have a specific treatment for it. The best way to prevent illness is to avoid getting exposed to the virus. So here's some of the recommendations that U.S. Centers for Disease Control and Prevention are putting out to help people at high risk follow and to stay healthy. I think we know it all. Avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water for at least 20 seconds, especially before eating, after blowing your nose, coughing, or sneezing, and before and after coming in contact with others. And stay home as much as possible. Make sure you have access to several weeks of medication and supplies in case you need to stay home for prolonged periods of time. Clean and disinfect frequently to touch surfaces, including doorknobs, light switches, keyboards, phones, handles, countertops, faucets, sinks, etc. Wear your mask. If you must go out in public, stay at least 6 feet away from other people, avoid crowds as much as possible, and wear a cloth face, covering your face. Be careful not to touch your eyes, nose, or mouth when removing it, and wash your hands after removing your face mask. If someone is receiving cancer treatment at a medical facility, what should they know about getting their treatment? What should they do about getting their treatment? Okay, so if you're currently receiving treatment for your cancer, Please call your healthcare provider before going to your next treatment appointment and follow their guidelines. As healthcare systems are adjusting their activities to address the COVID-19, doctors that are treating cancer may also have to change the patient's appointments from time to time, depending on the risk of the patient, their symptoms, any possible exposure that patient might have had to other individuals with positive COVID-19, etc. So the risk of missing a cancer treatment or medical appointment must be really weighed against the possibility of exposing a patient to infection. Some cancer treatments can be safely delayed, but others cannot. So chemotherapy generally should not be delayed because, like I said, the treatment for the cancer is quite important and obviously affects survival for a lot of cancer patients. Some routine follow-up visits can be safely delayed or conducted through a telemedicine. A lot of physicians are doing telephone or televideos. I'm sure many of you are now familiar with that. If you take oral cancer drugs, you may be able to have them prescribed and sent to your home directly, so you don't have to go into a pharmacy or an office to pick them up. A hospital or other medical facility can ask you to go to a specific clinic away from those treating people sick with coronavirus. So from time to time, my patients will tell me that they had their mammogram at a different center depending on the situation with that medical facility. So the coronavirus situation is changing daily, with states and cities making changes in how they're handling the quarantine and the critical health care. So check with your provider as much as possible to see what's needed, what you need to know. If you are participating in a clinical trial at a medical facility, what should you do? Okay, so if you are in a cancer treatment clinical trial, please call your clinical trial research team and follow their guidelines. Physicians and scientists at City of Hope are working with doctors and healthcare staff who carry out NCI-sponsored clinical trials across the United States to implement specific measures within our clinical trials networks that can address the current challenges that we're facing of providing care to those patients that are enrolled in clinical trials. I know, for example, some of the clinical trials that may require additional tissue biopsies that will require a patient to go in more often to the facility may actually be closed. So if you are participating in a clinical trial, you are most likely to continue with that, and that trial will remain open, but you should contact your clinical trial coordinator and research team if you have any questions in regards to your treatment dates and follow-ups. So the health of each clinical trial patient is the institution's most important concern. And the NCI designated centers, such as City of Hope, are flexible about how clinical trial treatments can be completed and when the tests and assessments must be done. So there is a IRB, or Institutional Review Board, that oversees each protocol to make sure that the safety of the patients will work with the investigators to quickly make changes that are required that will provide flexibility while maintaining the safety for the patient. So, do cancer patients experience different symptoms from normal people, regular people? And the answer is the symptoms of COVID-19 are the same in cancer patients as in the general population. There's some exceptions that I wanted to go through. So patients, for example, that are treated with steroids or other medications to treat leukemia and lymphoma, they can have a suppressed fever, or so, for example, they may not develop a fever, so that can be suppressed because of their treatment. If you have other symptoms of COVID-19, which includes fever, cough, shortness of breath, then you should definitely contact your primary MD and the cancer treatment doctor, cancer treatment team as soon as possible, so they can guide you to what you need to do beyond that, depending on your symptoms, obviously. If you test positive for COVID-19 during cancer therapy, then the decision on whether you need to continue with your treatment or stop it until you recover will really depend on a variety of factors that should be discussed between you and your cancer doctor. This can be affected by the type of cancer that you have, the stage of the treatment, and the severity of your symptoms. So we have to remember that the mortality rate for COVID-19, the highest mortality rate is probably less than 5%, as reported. But the mortality rate for cancer is significantly higher. So we should not ignore cancer diagnosis or the treatment for COVID-19. Here are some recommendations for cancer patients. So be mindful so that people around you don't bring COVID-19. I've had some patients that have asked their children to move out to minimize their risk of COVID-19 exposure. So cancer patients' immune system, as we said, are weakened and they're thus at a higher risk. Also, avoid going out to do activities such as shopping because the risk of catching the virus there increases. And those that live with a cancer patient are encouraged to be tested for COVID-19 every 3 weeks if possible. And definitely if they're showing any symptoms, they should be tested. And a person that is COVID positive, they need to stay away from a cancer patient until their symptoms are resolved or they test negative again. So what should I do if I have symptoms of an infection? You need to call your healthcare provider if you think you have been exposed to COVID-19 and have symptoms of an infection.